Tackling inequalities in health is a matter of social justice, according to the newly launched Health Equalities Group. The Health Equalities Group is a new health and wellbeing collective made up of the already established Heart of Mersey, together with HM Partnerships and the European Healthy Stadia Network. The group was launched on the 7th of October this year at an event attended by the Lord Lieutenant of Merseyside and the Lord Mayor of Liverpool.
Now we've relocated, we've rebranded, we've had huge changes in the team, and now this is the culmination of it all today.
We should all have the same opportunities, not as a result of where we're born or what education we happen to have.
We don't always get it right, but without organisations like this, and without passion, and us all doing it together, we won't make that difference.
So HM Partnerships was set up in 2008, and much more recently the European Healthy Stadia Network was set up. So now Health Equalities Group, which we're announcing the launch of today, comprises 3 organisations: the charity Heart of Mersey and the 2 social enterprises.
So there's particular concerns for me in the city around things like sunbed use, alcohol consumption, obviously drug and alcohol's related role, mental health, and of course heart disease, and all of those things have a factor to play with it. They're interrelated.
We have done initiatives such as working with mental health service users. We're working with COPD patients across Cheshire and Merseyside at the moment as well.
I'm very impressed by the commitment that I've seen, by the dedication people have, but also by the knowledge that individual people have, and their wish to work together to improve the lives and the longevity of people who live in Liverpool.
We are setting up Food Active, working across the Northwest as a campaign around obesity. That will be launched properly at a date in November.
The day also saw the launch of the first major project to take place under the Health Equalities Group banner. Hearty Lives, which is a pioneering project to improve health outcomes amongst looked after children in Liverpool.
I've talked about targeted interventions. The Hearty Lives one is one I guess I'm most proud of. It really comes from the British Heart Foundation wanting to develop projects working with the most disadvantaged groups across the country, and Gail will talk about that.
To reduce the levels of CVD, as we said, they are far too high. It's still the biggest killer in this country, and we need to continue the work that we're doing. But we also want to improve the uptake of health services. So all of the work that you're doing as well, bring you all together and make sure that people have access to your services. They know your services exist, and we can all work in partnership together.
We wanted to put a project together to work with young people, to work with children's services in this city, to see whether we could work to improve the lives of young people in care. And today we want to launch that project as well, the first big project for the Health Equalities Group.
What I was really keen when Robin first came to me, said, do you think this is a good idea? I said, look, the children, the young people themselves who are in care and who are in the care system or have been, have to be at the heart of this.
I would like to see engagement of young people in raising that awareness, just to even have that thought process starting, you know, maybe I should make a health change, but also widening that partnership further and looking at other agencies and stakeholders that we can work with and make an impact on.
So we need to work amongst our local communities with the most disadvantaged population to make it easier for them to have healthier lifestyles.
Let's get involved. Let's bring passion and collective interest to the table, and actually let's not talk about it, let's deliver it together, and I think that's what we're doing today.